This is BayCare Health Chat, another podcast from BayCare Health System.
Welcome to BayCare Health Chat. I'm Deborah Howell, and I invite you to listen as we talk about those amazing moments that happen while watching your baby grow and develop. Today we'll find out how joyful and important well baby visits can be, and so much more. I'm joined today by Dr. Ashley Wilk, who is board certified in family medicine and serves as a core faculty physician for the Florida State University College of Medicine Winter Haven Hospital Family Medicine Residency Program at BayCare. It's so nice to have you with us today, Dr. Wilk.
Thank you, Deborah. It's a pleasure to be here.
Lovely to have you. Let's dive right in. What are well baby visits?
So well child or well baby visits are essentially doctor's appointments that are meant for preventative health care for a child, pretty much from the time that they're born and go home from the hospital and continue throughout their childhood. They're essentially used to assess the baby's growth, their development. The physicians utilize the appointments to perform routine screenings, make sure that the kids are up to date on their immunizations. And then it also gives time to counsel the families about nutrition, behavior, and safety to ensure optimization of well-being of the child.
Well, that's lovely. Now, when is the first well baby visit usually scheduled?
The first well baby visit typically occurs about a day or two after coming home from the hospital, after the baby is born. They end up being somewhere between 3 and 5 days old. And during this visit, the parents get to meet their baby's physician, and they typically review the mom's pregnancy course, any concerns that arose during the pregnancy, as well as some details regarding the baby's delivery and their time in the hospital. The time between when the baby came home from the hospital and their visit is reviewed as well to ensure things are going well at home. A physical exam is performed by the physician, and any findings along with appropriate counseling recommendations are relayed to the parents.
Okay, and then what happens after the newborn's visit?
Most often at the conclusion of the baby's newborn visit, the parents are instructed to follow up in about 2 weeks to recheck their baby's weight. And this is just to ensure that they're growing properly. It's not abnormal for babies to lose a little bit of weight right after they're born, and that's because they do tend to come out a little bit waterlogged, so to speak. But we expect them to regain up to their birth weight by about 2 weeks of age. So that's the important number there. After their 2-week visit, as long as everything is going well, the baby is generally seen at about 2 months of age. And this is when they receive their first set of vaccines since coming home from the hospital.
Ah, the fun begins with the vaccines, right?
Oh, yes, I know.
What takes place at this kind of visit?
So at each of the well child visits, the child is weighed and measured. Parents are often asked to fill out a questionnaire, and this is in regards to the child's behaviors. The doctor will assess it to determine if the baby is developing both motor skills, social skills, and hitting milestones appropriate for their age. The doctor will typically ask questions about the child's feeding type and frequency. So this might include if the baby is being breastfed versus formula fed, as well as how much and how often they're eating. Routine for parents to also be asked about the number of wet and poopy diapers that their baby has each day. Also, sleep, including the number of hours the baby sleeps at a time, and the setting for the sleep is discussed with the parents. If the parents have any questions or concerns regarding their baby's feeding, their output or behavior, it's an opportune time for them to discuss it with the physician. In addition, physical exam at well visits include review of the baby's vital signs and measurements, as well as a head-to-toe exam of the baby by the doctor. This will often include looking at the baby's eyes, checking inside of their mouth, listening to their heart and lungs, examining the baby's diaper area, including to see if the testes are descended in males, examining a baby's skin, and then checking a few different movements to assess the baby's muscle tone and their reflexes.
And Dr. Wilk, when can parents ask questions about their visit, and what are some of the questions you should ask?
That is a great question because many new parents have an abundance of questions, which are all valid. There is no such thing as a bad question. So following the physical exam is typically the time that is taken to review any questions that parents have regarding the baby's growth, development, and their care for the baby. Finally, if any tests or vaccinations are due, the doctor will review this with the parents and order them as appropriate. After the doctor leaves the room, typically the nurse will come in and administer the vaccine that the doctor has ordered for the baby. At the conclusion of the visit, the doctor's office will have you schedule your baby's next well visit appointment so you know when they will be due back next.
And how often do these well baby visits occur?
The frequency of well baby visits is most concentrated early in life and then becomes a little bit less frequent as the child ages. The routine schedule for well baby visits starts out at that newborn visit, as we said, typically at about 3 to 5 days of life. Then they come back for that weight reassessment, typically somewhere between 2 and 4 weeks of age. And again, it's really to check that the baby is feeding well, that they're growing well and gaining appropriate weight. After that, it's at 2 months, 4 months, 6 months of age, and then it goes up to 9 months, 12 months, 15 months, 18 months, 2 years, and then it gets expanded to 2.5 years and 3 years. After the age of 3, the well visits are typically extended to once per year, so they have an annual exam similar to adults.
Got it. When does a baby become a child, like officially?
I would say that we typically distinguish at about 2 years of age.
Okay, so you can still do baby talk up to 2 years, right?
Of course, that's always acceptable. If they're your child, then it should be acceptable throughout their entire life, to be fair.
Now, what are some of the benefits of having your baby follow with a family medicine specialist from birth?
So the wonderful benefit of having your baby follow with a family medicine physician is that the same physician can take care of them and follow them from birth all the way as they grow throughout their life and even into adulthood. Family physicians care for patients of all ages and genders, so it's frequent that the baby's siblings and parents receive their medical care at the same office as the baby, promoting strong doctor and patient relationships through holistic care.
You know, that's so true. And when that child gets a little bit older and doesn't want to ask their parents some questions, they can always have that safe harbor of going to that doctor they've been to since they were a baby.
Absolutely. And that sense of trust and security is there with them since they've been seeing them on and on throughout the years. So that's a wonderful thing. And it's just nice to be able to not even have to make a transition when they age from 18 or 20 years old, when most pediatricians stop seeing their patients. They are able to continue throughout their entire life with the family medicine physician.
Yeah, you know you're an adult when you don't get a sucker anymore from the doctor.
That's right. We do have stickers, and I've been known to give it to some adult patients. Sometimes you just need a little bit of a sticker or a pick-me-up.
Exactly. This is a great topic and a great way to start your child's existence and get them on the right path to true health throughout their life. Thank you so much for being with us, Dr. Wilk. A great gift.
It's been an absolute pleasure. Thank you for taking the time.
My pleasure. And you can learn more about BayCare services by visiting baycarekids.org. And that wraps up this episode of BayCare Health Chat. Always remember to subscribe, rate, and review this podcast and all the other BayCare podcasts so we can share the wealth of information from our experts together. This is Deborah Howell. Have yourself a terrific day.